Somebody, give me one reason why diaphragms are important.
Pressure gradients.
Okay? Going along with that line of thought, why is a pressure gradient important? Do we want the pressure to be equal everywhere in our body, or do we want there to be, should there be areas where there's high pressure and low pressure and such? There needs to be pressure differentials. Why? Because I wouldn't be able to talk to you if I didn't have a pressure differential within my what? Right? I wouldn't be able to breathe. If I lost the ability to create pressure gradients, I wouldn't be able to breathe. If I wanted to move my bowels and I couldn't create pressure gradients from intraluminal to outside, I wouldn't be able to move my bowels, would I? I wouldn't be able to overcome sphincter pressures and have elimination. If I needed to urinate, I wouldn't be able to have bladder contraction that exceeds opening pressures, and I wouldn't be able to do that. So pressure gradients are important. At the same time, they have to be balanced within their normal ranges, because if they become imbalanced, then we can develop what? For example, in the lower extremities? Varicosities and other types of things. So pressure gradients are important. Why else are diaphragms important? What's their other function? What's their purposes? Okay? They act to form compartments. And why is that important? Why do we need to have compartments? Why can't everything just be moshed together? Because certain areas of the body need to be contained, right? Partly, again, because of this pressure gradient. Okay, so compartmentalization is important because certain areas need to be separated out through fascia, through muscle, which is usually what represents our diaphragms. What's another important element for diaphragms? What do we think about what do diaphragms do? They create pressure gradients through the act of making compartments. What else?
Assist in function.
Of what?
Organs and respiration.
And when you say function, you can also say
Structure.
function, we said, is, well, structure, function. Function is physiology, isn't it? Right? It's the living part.
So anatomy.
So it assists with the normal physiology. The diaphragms assist with the normal physiology, the normal function of the body, the normal function of the tissues. Helps to cause movement, to induce movement, or to prevent movement if it's needed. Okay? We talk about diaphragms as being what? Typically transverse in our normal standing upright organization. Transverse fascial planes, or transverse planes, right? So they have a transverse, in most cases, they have a transverse orientation, and usually, in almost all cases,